The 2022 to 2023 flu season is looking like it may be the worst one in years in the US.
It does seem right now like everyone's sick with something. I'm scared about what's going to happen this flu season because I don't think we've ever seen a coalition of multiple viruses kind of manifesting in this way before.
Experts hypothesize that COVID precautions led to much lower rates of flu-like illnesses compared to before the pandemic. But now that many Americans have abandoned preventative COVID measures, more people than before COVID are getting sick. One of those flu-like illnesses is the opposite of COVID in that young children are most at risk.
RSV is respiratory syncytial virus. So it is a respiratory virus that especially causes lower respiratory tract infection and pneumonia.
Both my girls ended up getting RSV in late September, and I was really shocked because that's extremely early for you to see RSV in the season. It's usually something that shows up later. It is an illness that primarily impacts children, although this year, ironically, we were seeing it in adults, which we never did before.
People always need to remember that flu and RSV kill people every year. And flu is one of those things where people are like, oh, it's the flu, it's no big deal. People die of the flu all the time.
But it's not just respiratory illnesses that are spreading rapidly.
Monkeypox, now a national public health emergency.
It's not just noise. We are having more diseases create illness. We'll never know if these were around before but not being reported, but there's definitely more diseases out there that are threats to different aspects of society in the US and globally.
If President Biden declared
the pandemic is over
in September, why does it still seem like everyone is getting sick? And what can we do about it? We've been hearing a lot about the rise in re-emerging infectious diseases in the news, and it's not just respiratory illnesses like COVID or RSV. One of the more prevalent re-emerging illnesses in the US is monkeypox.
Reemerge really means that is a disease that previously was in epidemic form or in widespread form in some fashion, became latent for a while.
This most recent outbreak of monkeypox was first reported in the US in May 2022. It spreads through close contact with an infected person or animal. Monkeypox was first discovered in humans in 1970 in the Democratic Republic of Congo. It was first detected in the US in 2003.
Humans can spread viruses to each other through contact, through secretions and touching your eyes and getting it into a mucosal surface, from breathing it in, from just being around it and getting into your system in some way, some breach, some open cut, etc. And the same way it spreads from animals to humans.
Re-emerging infectious diseases have been a consistent problem over the past 2 decades, even before COVID. Some shifts in lifestyle have made humans more vulnerable to these sorts of communicable diseases. One factor may be that there are more people living in cities now. The UN projects that nearly 70% of the world population will live in urban areas by the year 2050.
Industrialization is certainly a cause of the spread of this disease. And think about where this spread. New York City was the initial American epicenter. Milan was the European epicenter. These are areas where it's not just population density, so you're living in multiple generational families and multiple people in the same household, 5 to 10 people in some of these households. And the more people that spread there, and then they all have their own contacts, they can spread to other people.
On top of that, the major cities are also international hubs for travelers, which can lead to higher risk.
There's also the notion, and I don't know if it applies to 2020, but this notion of globalization and just kind of travel and being able to be in lots of different places and everyone able to be in lots of different places, having an impact on infection transmission patterns. And I think that's kind of what's happened with monkeypox.
Traveling was a major issue with the beginning of the COVID pandemic. Many of the workers in China went to Western Europe, and Northern Italy was regarded early as a source of many migrant workers. And from there, those folks went on global travel and global work. And it spread from other travelers to the United States and abroad. And that's really how it accelerated.
Another factor could be the global increase in meat consumption.
There's more livestock that's feeding more people, and they're kept in closer quarters. And there's all these different ways that they are trying to grow this populations of animals even more. And when that happens, they're in much more confined spaces. And a lot of viruses, if they're present in part of that population, will spread rapidly throughout animal populations.
There are other potential contributing factors to the rise in re-emerging diseases, many to do with environmental disturbances and climate change.
Whenever you take away forests, you move the animals that would normally be there into an encroachment closer to the human populations. When you do that, you also change a lot of other issues with the biodiversity. Insects change in population. Insects get closer to humans. And we all know that a lot of these viral pathogens are insect-borne.
I think it's been a collective trauma, and it's been hard to navigate our way through it. I think that maybe we just have to have no expectations because you can't really predict infections. Monkeypox has seemed to go down, but will it stay down or not? I don't know.
An early surge in cases of the flu and RSV are putting a huge burden on the healthcare system. Researchers estimate the flu costs the U.S. economy an average of more than $11 billion a year. Flu and RSV season usually start in the fall and last through the spring, with a peak between December and February. There have been more reported cases of RSV in each week of October 2022 than any week in the past 2 years. Doctors around the country are raising the alarm about hospitals being overwhelmed. Just like with RSV, cases of the flu started surging earlier this year, with the CDC reporting at least 1.6 million cases, 13,000 hospitalizations, and 730 deaths as of October 29, 2022, which is high for this early in the flu season.
I've been cautioning parents everywhere to be really careful about all of the viruses that are going on right now. We are seeing a very early rise in both RSV, flu, as well as COVID cases in the pediatric population. We think this is happening really because this is the first winter season we're going into where kids are largely back in school unmasked. And so both adults and kids are interacting in a way that's more similar to pre-pandemic environments. And so we think there's a lot of different viruses that maybe kids have not been as exposed to in the last 2 years that are popping up and really hitting the population hard.
Here's your other stethoscope.
I'm not only an emergency physician, but I'm also a mom of a 2- and 4-year-old. Both my girls ended up getting RSV in late September, and I was really shocked because that's extremely early for you to see RSV in the season. It's usually something that shows up later. And I was suspicious they had some viral illness, but I wasn't able to confirm what it was until I took my eldest into the emergency department when she got into respiratory distress, and she tested positive at that time.
As people started moving around, being in contact with each other, and transmission started to kind of happen more, that could explain why RSV surged. It did kind of catch us off guard because we just think of RSV as such a seasonal disease.
Lita's a good example of a corona baby who spent really the first year of her life, just home. And because I am a doctor, it was hard to even get a play date because you can imagine that I wasn't necessarily the mom that other moms wanted to hang out with. So I tend to only go around families that were also in healthcare who understood, the risks that we were taking in order to do our job and take care of those that were sick.
2022 isn't the first year we're seeing an early surge in RSV. Cases also rose in the spring of 2021 as COVID vaccines became widely available to the public and society began reverting to pre-pandemic behaviors such as not wearing masks.
This year's is also earlier, but what's especially making it remarkable is that it's so high.
The danger with that is that our healthcare system is just really crippled right now in the sense that we don't have the staff we need to take care of everyone. And so any kind of surge or peak in incidents like with RSV maxes out our resources. And so when I'm seeing sick kids with RSV and I need to transfer them to a pediatric hospital, I cannot find them a bed. And that means that I'm forced to board them in the ER for hours, trying to look for a place for them to get a higher level of care. And that means waits go up. And, in some cases, it makes it really hard for us to take care of these sick kids.
There's no cure for RSV, but its symptoms can be managed.
All viral illnesses are really managed in a similar way. We support the patient by controlling their fever with medications like Motrin and Tylenol. We give IV fluids if the patient is dehydrated.
They might be given oxygen to help them breathe.
And then we might even give oral or IV steroids if they're particularly sick.
The ultimate solution for dealing with RSV is a vaccine, which researchers have been working on for decades.
An important point about RSV is that this is a virus that we have known about. It was identified in 1955. And so vaccine development for RSV has actually been an ongoing goal.
Pfizer reported in early November 2022 that its RSV vaccine, which was given to mothers during pregnancy, was nearly 70% effective at protecting severe symptoms in infants less than 6 months old.
For RSV, because the children at risk are newborns and very young children who might have trouble developing a good immune response to a vaccine to begin with, and also are at risk during the time that we typically vaccinate young children. And so one of the strategies is to try to get the mother, the pregnant mother, to have a good immune response and help carry that through to the baby.
I know that we are working hard and diligently to get an RSV vaccine, and if and when that becomes available, I absolutely will be vaccinating my children. And my child actually does not mind taking shots. She smiled through every COVID vaccine that she got, all 3 of her COVID shots.
Yay, good job, Ada!
The U.S. began rolling out the monkeypox vaccine in May 2022 to those who were the most at risk of contracting the virus. Unvaccinated people have 14 times the risk of contracting monkeypox compared to those who are vaccinated, according to preliminary CDC data. Vaccines may be the ultimate preventative solution, but there are other measures people can take to slow the spread of illness.
There's so many other diseases out there, and a lot of these are also related to hygiene and hand washing.
What I emphasize to everyone is that prevention is the best method to protect yourself. Basic hygiene, hand washing. If you are sick, stay home from work, stay home from school, and then most importantly, to vaccinate. We are in a flu season again, so you should also be getting your flu vaccine. If you're older, you should be getting a pneumonia vaccine. We're not really sure what this winter is going to bring us, so I really ardently, propose that everyone does what they can to protect themselves now.